So this is take 2 on this video. I taped this on May 6th. Today is the 17th of May. I taped it a long time ago, and it was an awesome, pretty day outside. I was outside on my deck, and the birds were chirping. Everything was perfect. My hair was doing its thing. It was so pretty. It was full, because you know my hair is different every day. So, and then when I went to look at the video so I could edit it today, it showed about this much of my face from here on down. Audio was great. Everything except you couldn't even see who was talking. You could kind of tell, but at any rate, so here we are again. So what I wanted to share was on that day I had 3 major appointments. It was a very big day for me. I was super nervous, so nervous that I couldn't sleep the night before, because just of the anticipation. I didn't know what to anticipate with this appointment, so I was just super nervous, and it ended up being okay. So I started the morning with a appointment with physical therapy. I got there, filled out the paperwork, you know, the normal rigmarole. And when I got in the room with the physical therapist, she just started just by talking to me. She asked me questions. I could tell through the conversation that she had read my chart, and she knew history, not just my current history, but she knew past history. And I really did like that she took the time to really know about me, and I just wasn't another number. I wasn't just another breast cancer patient that she's doing some pre-op teaching on. I was really Krista. I was a unique individual who had unique needs and a unique experience. So, you know, it was great. She kind of went over some exercises that I'll have to do following surgery. The reason why I need this PT appointment is because I will be having a sentinel node biopsy. So that's where they take out the initial lymph nodes. They're called the sentinel nodes that the cancer would go to first if it were going to spread outside of your breast. So she's going, so when they do that, remove lymph nodes, and if there is a possibility that after they test those lymph nodes that there may be cancer in those lymph nodes, and they'll have to take out additional. So regardless of where the cancer may or may not be right now, these are tools that I'm going to need anyway. So she talked to me a lot about how some things are just going to be different for me after having these lymph nodes removed. Mainly, I'll be at risk for lymphedema, which is just a fancy way of saying swelling, because the lymph nodes won't be able to filter the fluid like it does currently, because I have them all. So at any rate, she went over some exercises, because I won't be able to raise my arm above, you know, I won't be able to raise it that high. I think she said just about here, and I won't be able to lift anything over 5 pounds. So probably should see how much my laptop is, how much it weighs. But I have some help that'll be able to do some things like that for me. So at any rate, we went over those exercises. She took some measurements of my arm, because if I do call her and say that there's some swelling, they want to be able to say what was my baseline. So now they know the size of my wrist, the size of just various parts of my arm, so they can tell whether or not I am retaining fluid or not. So that's good. I really just felt good about that appointment. So that was my first appointment. Then after that, I went to the hospitalist, and the hospitalist, which I learned later, she was internal medicine doctor. So they want you to see a hospitalist, and you know, because I'm going to have two different surgeons that are going to be performing surgery on me at the time that I have my surgery. So I started that appointment. I saw the nurse first. She wanted to do, so I didn't know what to anticipate, right? So that's why I was nervous and I couldn't sleep the night before. So the nurse, she wanted to do an EKG, of course, take my basic vitals, and then she also wanted to draw some blood, and then she had some goodies that she wanted to share with me, which I'll share with you as well. So the funny part about this appointment was, so you know, you're getting up, you're going to a doctor's office, so I wanted to be fresh and clean and you know, all that. So I took my shower before I left. I lubed up real good with my coconut oil. And then she's trying to do the EKG and the leads keep falling off. Oh my God, it was so funny. I was a little embarrassed, but it was funny. I mean, I'm sorry, I didn't know. No one told me what to expect on this appointment. Had I known that she was going to do an EKG, I probably wouldn't use coconut oil that day. I probably would have just used regular lotion. So at any rate, I said, well, why don't you try to use some alcohol pad, you know, to try to wipe off the areas that you're trying to put the leads on. So we tried the alcohol. Honestly, I just don't think she rubbed hard enough. I didn't put that much coconut oil on. So they still wouldn't hold. So she ended up having to tape them. And honestly, I promise you, the tape was coming off. Oh my God, I was so oily. But my skin felt good. So at any rate, she was able to get the leads to finally hold at least long enough for her to get a couple tracings that she thought that she would be able to use. Once again, it was just to get a baseline, to see if I had any abnormalities, you know, with my heart rate, my heartbeat, and so that they would have that should anything happen during surgery. So we went through those things, and then she she gave me this little cheat sheet, so that's what I'm going to speak from. So then we talked about some things that they want me to do in preparation for surgery. So first off, they gave me this nice bag right here. It's a cooler bag. It has wheels and a handle that, you know, it shows up. And so there was a lot of goodies in here. And I use that word lightly. So the first thing on this list was breathing. So if you've had any type of surgery, you've probably seen something similar to this. It's an incentive spirometer. It's supposed to help you with your lung capacity. So anyway, I have to do this 2 times a day leading up to surgery from that appointment. And then what else we have on here? Oh yes. So these lovely nutritional drinks. It's called Impact Advanced Recovery, and it's a immunonutrition drink. And it's basically, it is a protein drink, and it also has amino acids in it. So it's really supposed to provide support after major surgery. So at any rate, I have to drink 3 of these a day for 5 days leading up to surgery. So that was one thing. I can go ahead and share that because I had to retape this video. At the time I originally taped it, I hadn't tasted it. It tastes like a bad protein drink. Is it doable? Yeah, it's kind of thick. This flavor is vanilla. I tried to spice it up with fruit because they told me that that would work, but for me, I don't know if my blender, I have a Ninja, and I don't know if it was just the speed was too fast and it just became too frothy. So I would drink some, then I have to wait for the froth to kind of, you know, settle and become a drink again. And it was just too much work, and it really didn't make it taste any better. So I just drink it plain now. I got 1 more day to drink it. I'm good. the other thing is that starting today, I'm supposed to take a bath with Hibiclens. So they gave me 2 bottles. So I'll take a bath with those tonight, tomorrow night, and then the morning of surgery. And that's just to reduce germs. And the last thing that I was told at that part of the appointment was that I need to drink Gatorade the afternoon before surgery, the evening before surgery, and the morning before surgery. So the first 2 times I'll drink 20 ounces of G Series Gatorade, and then the last one will be 12 ounces. So 2 20-ounce servings and then 1 12-ounce serving the morning of surgery. So I don't like Gatorade. They were very specific about the type of Gatorade. It's supposed to be G Series. So my husband went out and bought several flavors of Gatorade for me last week, and we just had a taste test. Which one could I manage the best? So anyway, we found 2 flavors that, because the bottles were however many, it was enough. Because I think that's 40, 50, I'm supposed to have 52, and I think it equals 56. So I've got more than enough to Gatorade to drink. I'm not even sure what the purpose of the Gatorade is. All I can say is that from all this drinking, I'm going to be very hydrated. Oh, what I didn't mention is this is not a meal replacement. So I have to eat my regular food, then try to take this protein, which it is hard. It says it's 200 calories. So if I already ate a regular size breakfast, lunch, and dinner, and then I'm supposed to, yeah, at any rate. So I guess I haven't ate all my meals because I can't eat all that. I look like I can, but I can't. So at any rate, so I had to do that Gatorade. So that was that appointment. That wasn't that bad. And then the last appointment I had was with the nurse practitioner at my surgeon's office. So when I get to that appointment, I knew that this was going to be a surgery teaching type appointment. So I made sure that I had enough battery life that I could FaceTime with Anthony. So I was able to get him on the phone so he could hear it, because he's going to be the caregiver. What use is it? You know, great, I'm glad you're telling me, but honestly, the person who's going to be taking care of the sick person needs to hear it firsthand. So it's really just unfortunate during all of these precautions that in times like these, you really just can't have the people with you when you need them. So at any rate, we were still able to overcome that obstacle. It's a minor bump in the road, especially in relation to everything that's going on. So she showed me the bra that I'm going to leave the hospital in, which is a lovely little ditty. Just kidding. It's just a plain white cotton. It looks like a sports bra, and it snaps in the front. I mean, it's as plain can be. It just kind of just looks surgical. So at any rate, I'll have to wear that lovely thing for at least 2 days. She also showed me a camisole as an option, but I never did look into it because they said I wouldn't need to wear it but only a couple days, and I think they said it could be a little pricey. So for me, it just didn't make sense to get it for this round. Maybe when I have my reconstruction, maybe I'll get it if I need to wear something like that a little bit longer. But so at any rate, I didn't get the camisole, which I think I would have liked better actually. So maybe I should have, but it's too late now, 2 days before surgery. So she talked about that. We talked about the drains that I'm going to have, I'm at least going to have 1 drain. I may have 2. I don't know. We'll see. So they're called Jackson Pratt drains. They look like a little hand grenade. So once I get those, I'll be able to share what those look like. We'll have to drain those twice a day and measure the fluid that's coming out. So I'll show you that whole process so you know what to anticipate should you have to go through this yourself, or maybe you're getting prepared for surgery and you just would like to know, like I did, what to expect. And then what else did we talk about? Oh, she talked about pain meds, so they're going to give me a block in my um, muscle, uh, and they said that the block should last for about 2 days, which is why they kind of feel comfortable that I could go home same day after surgery. Yep, same day. Yep. So that. What else did we talk about? Oh, I didn't bring it in here. Well, she gave me a lanyard to hook my drains up to when I'm in the shower, and then she also gave me a heart-shaped pillow that I can use under my arm to help with that incision that's going to be right there. Yeah, what else we talk? Oh, we also, in regards to pain, I'm going to get a muscle relaxant enough for 2 weeks. And then in addition, oxycodone, and she said take that with Tylenol, which combined makes a Percocet. And so I'm supposed to alternate those two pain medications, the muscle relaxant and the oxycodone plus Tylenol. Take one, then take one 3 hours later. So really you're taking, like I'll take the muscle relaxant every 6 hours, and then I'll be taking the oxycodone and Tylenol every 6 hours. But it's going to be in 3-hour increments. I'm supposed to take something. So she said, make sure you keep up with your meds. So you know what that translates to me? I'm going to be doing a lot of sleeping, because that's what that kind of medication does to me. So if you call me or you text me and I don't respond right away, it's because I'm getting a good nap, which is fine because I haven't been sleeping here lately anyway. So I'll get to catch up. So we talked about pain medication. She talked about that. Oh, and then she also told me that I was going to have a COVID-19 test prior to 96 hours prior to my surgery. So the Saturday, she already had appointments set up. Yep, they don't ask you about appointment times. They just set those appointments up for you, which is kind of okay, because guess what? I'm going to be there whenever they make the appointment anyway. I have nothing else to do but to try to get rid of this cancer. So I will be there. I will make myself available, whatever I have to do. So I think that's all. So at the end of that day, I also ended up having my genetic testing, because in the morning, I was waiting for the test kit to come to my house. And it did arrive while I was at my appointment. So my husband brought it, put it in my car, because he can't come in the hospital and give it to me. Put it in my car, and then I went out, got the package, went back through registration. Yep, had to register again. I think I ended up registering 3 times that day. Let me see. I registered for PT, registered for the hospitalist, I registered for the surgery training. I registered 4 times because I had to register to get the lab. I mean, come on. So at any rate, that's probably how they charge you by your registrations. I don't know, my guess. So at any rate, I registered for that, went back to the lab, which happened to be in the same area where I had saw the hospitalist earlier. So they drew my blood. It was really quick, and I was able to send that off. And I do have those results back. I'll share that in another video. So really, I was all worked up for this appointment, because it was going to be a big day. It was like I was meeting with 3 different people, and I had no clue what to anticipate. But it really, really, really wasn't that bad. And I survived. I made it on the other side of that appointment. So I'm just at the point where I am just trying to get ready for surgery. And that's all. Thanks for listening.